Hi, welcome back to Bedroom Brainiacs. December is HIV and AIDS Awareness Month, and since HIV was first discovered and named in the early 80s, there has been 40 years of research and scientific study to learn more about HIV and how it works. So if you learned about HIV in the 90s or early 2000s, and you haven't really paid attention to it since then, I'm going to give you a quick overview of the main lessons we learned with the past 40 years of research. So when we first learned about HIV, it was considered a death sentence. HIV is a virus that damages your immune system. So someone with HIV and a damaged immune system does not have the ability to fight off infections or diseases, and so they are much more likely to get seriously ill and die. But because of treatment and medications, the death rate has gone down. So the death rate for HIV peaked in the mid-90s. In 1995, the death rate for HIV was 16.2 out of 100,000. And the death rate has declined since then. A couple years ago, in 2022, the death rate was down to 1.2 out of 100,000. So now someone who is HIV positive can have the same life expectancy as someone who does not have HIV. This is dependent on a few factors, those factors being early detection of HIV. Another factor is access to good medical care, and another factor is following a treatment plan. So if someone does those things, they can have the same life expectancy as someone without HIV. The next thing I want to talk about is prevention. So originally, the only way to prevent the sexual transmission of HIV was abstinence, not having sex at all, or using condoms and other barrier methods. Now there's a couple new medications that someone can take to reduce the risk of getting HIV. Those medications are called PrEP and PEP. PrEP is pre-exposure prophylaxis, meaning that it's a medication you take to prevent getting HIV. The other one I mentioned is called PEP, post-exposure prophylaxis. So if someone thinks they may have been exposed to HIV, they can take this medication and it will reduce their risk of transmission. Everything else about prevention is still the same. It's important to get tested regularly. It's important to use condoms, and possible practice abstinence. Now, the next two things that I want to talk about are a vaccine and a cure. Currently, there is no cure for HIV, and there's also no vaccine to prevent HIV. That is still true today as it was 40 years ago, but there has been a lot of studies and clinical trials trying to find a vaccine or a cure. So more than 30,000 people have participated in trials looking for a vaccine for HIV, and there's also lots of clinical trials to hopefully find a cure for HIV. Currently, there is a clinical trial happening that uses gene editing therapy with the intention of curing HIV. This trial will go through spring of next year, and hopefully after that we'll have some more information on if it was possible, if it worked. You might have also seen some headlines about HIV being cured from a bone marrow transplant. Yes, that has happened. It has happened in about 2 or 3 people. They got a bone marrow transplant not with the purpose of curing their HIV. It was for another medical reason, but the bone marrow transplant did cure their HIV. So obviously, something like a bone marrow transplant is not available to most people, but it's good news because it does tell us that a cure is medically possible. So those are the main headlines and the main lessons that we've learned from 40 years of studying HIV. And hopefully over the next few decades, we'll learn more lessons and get some more research and some more progress into learning more about this virus. Thanks for watching.
Hi, everybody. Thanks for watching. Please stay in touch with us by subscribing to our YouTube channel, following us on social media, and absolutely please comment below and let us know if you have any suggestions for future topics. We would love to hear from you.